Hello and good day, Professor Mel. This is my FMA3 report submission, which is focusing on an organization called Speak Up Africa. That is what I have captured in my FMA1 topic. So, to give a hinge on what the report will look like, so I'll cover into three different parts. Part one would be an introduction of the organization, followed by the methodology that I have used in order to evaluate this ACSM organization. And finally, I'll cover in part three conclusion as well as data analysis and recommendation. So, as a quick introduction again to this organization, so they are headquarters in Senegal, and they're really an organization that is organized, obviously, for basically training and conducting advocacy campaigns via multiple different media platforms. And from the website as well, they're looking at or trying to influence not just the leaders but also key civic organizations in order to promote and enable policy change and of course increase awareness of the sustainable development updates or progress in Africa. So for me, I've chosen this organization because somehow when we think about sustainable development, we always look into, well, Africa for obvious reasons that but the vast majority of the country is still reeling from development as a result of corruption and general mismanagement of the country. It's probably an overstatement for some countries, but this is just a generic observation based off of what we're reading in the news and listening to the news and reading articles. So for this particular paper, I'd like to propose and discuss the evaluation methodology and approach that I have used to evaluate this particular organization. So here I put in three different steps, starting from data gathering, followed by getting the data and putting it into a process model, plus the evaluation metrics or methodology, and finally using the data and analyzing the data and forming some conclusions, and of course making some recommendations. So in a nutshell, this is the approach that I have taken or that I have took in order to, number one, qualitatively assess the organization from the particular methodology that I have used and present a sort of an assessment into how effective and efficient this organization is as far as running those campaigns, conducting those strategic communication sessions, training people, and ultimately benefiting the stakeholders, the African people for that matter, as well as the funds that are donated by the donors, and see whether their donations are making any impact at all to the lives of the common African people. So, in order to sort of put a framework into the analysis and evaluation methodology, I had to go back to this, what I call process model, and really dissect this organization from a standpoint of considering the whole organization as a process by virtue of its many different programs in place. And then the input to that process will be four different M: man, materials, method, machine, and environment, categorized into different factors or parameters. And the whole idea behind is all these parameters and factors will come together and produce a desired output, which in this case, the indicators of the output of the process would be, has the beneficiaries' lives been impacted? Were there any, economic, social, psychological impact of this organization? And then, of course, if there are any policy changes that has been made, to assess whether this organization has indeed benefited the whole stakeholders. So moving on to what are the questions that have been designed in order to evaluate and assess this organization. So if you can see on this presentation, I have put together several questions per category of the parameters, 3 each for man, 3 each for material, method, machine, and so on and so forth. And each of these questions are designed in such a way that we're going to evaluate the categories involved. And at the same time, just for context, we're only looking at evaluating this organization purely from the impact report that they are providing on their website, which is shown here on the URL address, and specifically zooming into their malaria program as part of their whole program structure. And so that's one area. Second area is the output parameters are also being evaluated. And I also designed these questions based on just three aspects of the parameters of the output. So in a nutshell, as a caveat, normally when organizations put up a report, we're as a third party evaluating the organization, we are treating it at face value and not really digging into the details, because for two reasons. One is, we're not privy to this information. Second is that obviously these are public information that's out there on the website, and therefore it's only meant available for public consumption. Okay. And since these questionnaires are mainly designed in order to assess and evaluate this specific org, I have put together 1 to 5 as a scale in order to assess this qualitative data. And 5 means excellent, 4 very good, 3 good, 2 average, and 1 poor. And the whole idea behind is to get a good flavor as to what kind of performance this organization has been putting together based out of this 5 scale. So a couple of reference here just to hinge our or my evaluation. First is on the left hand side, you can see the reference implementation strategy, if there's any advocacy out there. And this particular cycle, if you will, was adopted from the URC reference, Health Communication Behavior Change. And really what it does is to demonstrate to potential organization leaders how an advocacy works in terms of, analyzing the background, what is out there for as an opportunity, developing a strategy to change behavior, implementing the program change, as well as evaluating a particular program, whether there's any impact at all. So for this particular Speak Up Africa organization, I have looked into step number 3, 4, and 5, obviously, to be able to assess this org from this particular assessment strategy standpoint. And ideally, on the right-hand side of the scale, this particular table was drawn from the Global Fund, from WHO toolkit called Monitoring and Evaluation Toolkit. So if you look at this, it's a very straightforward monitoring toolkit wherein it tabulates the baseline information, a specific timeline, and then the target or goal for a particular metric. So ideally, this would be a good example of how an organization's going to be evaluated, looking at the baseline and then looking at the target. So these are the two parameters, if you will, that I have looked at for this particular org. Now, going back to this organization and how I have evaluated this. So here you can see the upper graphical representation that shows the input, the process, and the output of what we call the process model. And really what I did here was to capture what are the input parameters based out of the questions or the parameters that was designed in terms of questions. And then I look at it from the high score, low score, and then average score perspective, both from the input and the output side. So really what this model does is it allows for any assessor or evaluator to score the answers based out of data points gathered and collected, and then from there assess the information and present it in a manner where it's going to be very visually understandable. And now, based off this evaluation checklist that I have designed and created, I have scored the organization's performance based off the 1 to 5 scale and put together what I call a radar chart. So based out of this radar chart, you can see, again, for context, if a data point is closer to the target, then it means it has a very poor performance or very poor indicator. So that means the leaders of this organization needs to put more focus on this particular area for them to improve, or for that particular parameter to improve, and therefore get it out of the radar screen. So here you can see from an input parameter perspective, there are a couple of twos, a handful for that matter. Mostly it's in the threes and then also in the four areas. So by looking at this input parameter radar chart alone, you can see that as a whole, the organization has put together some really solid and robust measurement indicator in terms of how they organize themselves. So from the output indicator perspective, you can see that I've only had 3 questions to measure whether the performance of the organization is acceptable or not. And from just looking at these 3 parameters, you can see that there's 2 and 3s, which for me tells a broader story in terms of how the output of this organization to have more impact to the general community as well as to the stakeholders that they're managing. So here you can see the result of this evaluation shows from the numbers, they're just rating as average. Although from a change in policy perspective, I would rate them as good. So overall, there's a lot that remains to be achieved if we want, if the organization wants to improve moving forward in terms of getting the impact that it needs for the general community. So with this result of the quick evaluation or assessment criteria that I have designed and developed in applying what we have learned so far in this ACSM context, I have put together just a quick summary and conclusion of this whole exercise. So first, a novel methodology has been utilized to evaluate, the chosen ACSM, in this case, Speak Up Africa. And the methodology involves a simplistic approach wherein we model the questionnaires using a process model, considering the input, capturing the organization as a process, and then assessing the output of that organization through multiple different parameters. And then from the result of the evaluation, it shows that the org in general is showing good results. There's a handful of twos, majority are threes and fours from a scale of 1 to 5, 5 being excellent, 1 being very poor. And then only if you look at the output of the program, specifically the malaria vaccination as an example, just zooming in that particular program alone, much remains to be done as far as producing tangible results for its desired or the targeted beneficiary. So in a nutshell, if we look at the totality of this organization, on one hand, they're organized pretty well. They're targeting the right amount of people and beneficiaries. They're gathering a lot of donors and fund managers and civic organizations, putting them together to work as a team in order to drive a number of different SDG goals for Africa, in particular disease prevention and disease elimination. But if you look at it from the totality as well of the output and the impact this organization has, while on one hand their campaign and training programs and then social channels are really very active in targeting the right amount of people, on the other hand, the impact that they have on the general community, for example, questions that needs to be asked is, has the malaria occurrence really coming down? Has the disease being eliminated or at least minimized, or they're making improvements year in and year out? So those kinds of questions remains to be seen as far as what I can see on the impact report alone. I don't know the numbers as far as the grassroots is being tracked or not, but from what I can see on the website, this is the conclusion that I have generated. Therefore, here are my recommendations based off this evaluation that I have done for this particular org. There are three. First is, the org needs to focus more on the impact of the programs, especially the output of not just on training, awareness and communication aspect. Much remains to be seen. Although they're really very good in showcasing what the organization has done by virtue of seeing the improved funding that they have had so far. But for me, I think that there's many more ways to quantify the impact of these programs, and it has to be generated in the form of a numerical report. Maybe it's my training because I'm a trained engineer, but at least this is one area where we can see that they're really measuring the right amount of data in order to improve long run. And also, the third recommendation would be the impact report need not just show numbers, but also show the impact it has on the stakeholders and beneficiaries. Because ultimately, in an ACSM organization, while you're putting in a lot of effort to make awareness and communicate what your advocacy is, the most important aspect is mobilizing the community in order to make a change and behavior change in all areas, such that what you're doing is literally impacting the community and ultimately meeting the sustainable goal of the UN. So for me, that's a quick recommendation from this evaluation exercise.